I do explain to people that hair growth, especially on the face, can be hormonal. So if you're a woman and you're sprouting chin
It's
hairs,
very hard on the face to get
please
rid of.
don't think that 6 sessions of laser hair is going to get it gone for good.
Hey everyone, welcome back.
Woohoo! We're
Unfilter
here.
It with
Unfilter It
Lindsey
and China.
So we are on part 2.
Part 2, energy-based devices.
Yes, laser beams.
Lasers.
So today we're going to talk about
2 powerhouses, I would say. Like,
Yes,
of the
powerhouse.
industry.
of the industry.
Definitely.
So, number 1, Fraxel.
Fraxel.
Fraxel has been around for eternity.
Eternity.
Has been changing faces around the world.
I mean, it is probably one of the best known laser treatments across the board, across plastics, derm, like
It's been
all over.
It's been out forever, and sometimes there's newer devices or lasers that come out, and then they'll be gone a couple years later. Fraxel is here to stay. Has
tried
been.
and true.
So the
An
laser.
old but goodie.
It is. It's great. I
Oldie
love
but
it.
goodie. It's so good.
So Fraxel is my favorite laser.
Why is it your favorite lens?
I feel like it's easy. It's not so painful for patients after we numb them, of course. The results are great. So let's just talk about what Fraxel is, who it can be used. It can really be used on anyone, but things that it's used for.
Tell me.
Let's just get the nitty gritty.
Tell me, what is it all about?
Fraxel Dual is the laser we have. It has 2 different wavelengths, 1550, 1927. And both of them kind of do different things, but also a little bit similar things. One of them is for dark spots like sun damage, if you have dark spots anywhere on your body. It's not just for the face, people, it's for anywhere. I've treated someone's whole body before, a couple different people. They hated their arms, their freckles, whatever. Another thing, it's really good for acne scars, resurfacing, so think of Fraxel as resurfacing. It can also do some tightening, so think of Fraxel as tightening as well. Not always my number 1 choice for tightening, but I love it for someone that has some fine lines, wrinkles, has some sun damage, kind of wants to do both, and boom, you're done. It looks great.
It definitely, I think, is the biggest bang for your buck, if you will, because it covers
Definitely.
a lot of different like if I have someone that comes in and their main concerns are, I have these fine lines I don't like, but I also have these age spots, like I'm
Boom,
immediately
Fraxel.
thinking of Fraxel.
Yep.
And so I just want to touch on a little bit what you just said. So Fraxel's been around forever. People associate it similar to CO2 laser.
Yeah.
It's a little less invasive than CO2 laser, so I just want to like touch on that briefly. CO2, if you think about it, is fully ablative, meaning it is a controlled burn. We're burning everything down to a particular layer.
So that's full resurfacing.
Full resurfacing.
2 weeks downtime,
At
skin
least.
pink for months after.
Soaks afterwards, like scabs. You
The
look
whole
like a
thing.
fish.
So I feel like CO2, people might think of it when when patients come in and they're getting their facelift.
Yes,
or
and
something.
still
A
a
lot of
very
times they're
great,
doing that.
still great option for skin tightening. Fraxel, on the other hand, uses a similar wavelength. So all lasers have targets. And so the target is based off of the wavelength, and I could talk about the physics of lasers.
Forever.
I think there's actually college courses on it. I might have taken a couple, but we could talk about this forever, but the in a nutshell is the wavelength of the Fraxel is targeting water. So it's basically going down to a level where it's targeting the water, dehydrating it, so essentially causing a small burn in a fractionated way, so in a grid pattern, so that there is areas of untouched skin in between.
And that's what helps with healing.
And that's what helps
the
with
difference
healing.
is between partially ablative and full ablative.
Right,
If
right.
you look up anything about Fraxel, it says it's not technically ablative.
Not
but
ablative.
honestly, it gives results like it is.
It does.
It is. So
It
I feel like
does.
you can't. It's hard to categorize.
And I feel like what's nice about the Fraxel in comparison is definitely there is a reduced downtime for
Huge.
sure. And most of the time I'm telling my patients that the Fraxel downtime is similar to a mid-depth chemical peel, where
Absolutely.
it's about like 4 or 5 days where you just like kind of
Something's happening.
maybe you want to
So,
wear makeup.
Just like we talked about their appointment for any of the any like microneedling healing, radio frequency, soft wave. So same thing, your appointment for Fraxel would be you come in, plan to be with us for 2 hours, you're numbing for an hour, and then we do it. When you leave us, you're going to be red, look like a sunburn, can be a little swollen. As the numbing wears off, that first hour or two, your face feels really hot.
Yeah.
So I tell my patients, drive home, put the air conditioning on in your car, blow it on
and
your
it's
face.
like a buildable heat. Like it starts off like during the treatment, you might not feel a whole lot of heat. Some people do like towards a couple passes down their line, but the
It's not that bad.
No, it's most people actually
at all.
come and describe it, and I'll describe it to you. It's like a bat, like you were at the beach and you got in your car, and like that heat from the sunburn is building.
When I was younger, remember we'd put like Hawaiian Tropic on and all this oil.
And the tin foil.
And then my grandmother would have me put Noxzema on my sunburn.
Yep.
I feel like it made it worse. I don't know.
Definitely.
Who knows? I don't know. But
you would get the chills.
So no Noxzema after
it's
Fraxel.
mentholated, so like you would get the chills from sitting in the Noxzema on. Oh my gosh, I remember
Sidebar, sorry.
So it's a similar build.
It's a similar build. So it's like a bad sunburn.
It's a bad sunburn.
Then after a couple hours, it's not really hot anymore. But then as the days progress, the treated skin starts to get darker and darker and darker.
Because it like dries out and it's kind of almost like it's becoming a scab, if you will.
Yeah, exactly.
Yeah.
It's not like a thick scab or anything, so don't worry about it.
It's like the sunburn scab you get.
It's kind of like that, and then you peel it. So then it would peel on its own, but I find day 3, day 4 after your treatment is when you're kind of looking the weirdest.
Yeah.
Where you're kind of dark and peely and kind of like lines on your face, kind of like hashtaggy. You're looking a little hashtaggy.
I do feel like if you're younger and you're doing this treatment like as maintenance and like maybe for some sunspots, but you're like under the age of 60, it's usually day 3. If you're a little bit older, it's usually day 4. And I think that has to do with like how our cells are turning over and healing. It's a little bit longer when you're older.
So I think that's good. You can, after 2 days, we have some really good makeup that we sell in the med spa. What's it called? Oxygenetics. And you could use that. The big thing with that is that it's breathable. So you're not putting anything occlusive on your face to, because you really want it to breathe after. A lot of people really like Aquaphor afterwards. We do give a skincare kit right after the Fraxel treatment to you. It's included in the price.
I got to tell you that skincare, and I'm sure the estheticians can touch on this more than we can, but the post-care kits that we have are really good. It actually speeds up the process. It speeds up the healing process.
So I think that really helps. And that's it, Fraxel. I mean, and the same thing, Fraxel, it's not always a one and done. Patients are very happy.
What I do love is that it's customizable. So you can come in, and if Lindsey or I are looking at you, say, you know what, we need to treat some of the deeper structures, or you just need superficial, we can tailor the laser treatment to that particular patient.
Right. So, and I feel like that's how we are with everything. Like we will tailor it to you. Some patients have, all these wrinkles around their mouth, perioral wrinkles that they hate. So I will do one wavelength there, and they have no discoloration in that zone. But then I'll use the other wavelength around the rest of their face. So that's really a good thing, instead of just always doing the same wavelengths, the same passes on everybody. It's not.
One of my other favorite treatments to do with Fraxel is the back of the hands. Like that was a slam dunk. And it takes not a lot of time. It's like you can do it as an add-on, or you can do it as a standalone treatment if you want to. It's quick, and the downtime for the hands is like almost next to nothing.
It's no big deal.
It's really quick.
But how Fraxel is, so we do the treatment. It's 8 passes, no matter what wavelengths we're using. And that's really the Fraxel jam.
That's the Fraxel jam. Yeah. Everyone's been really happy with it for years and years and years. Like,
even if you have melasma, there's settings for melasma, so some patients are really nervous about
I have some patients that come in and I recommended Fraxel. They're like, Fraxel, that's still around? I used to get that at my dermatologist's office.
Yes, it's around and still epic.
This is one of the energy-based devices that it's because it's so good and the wavelengths are like, where it's at to treat the dermis, that it's one of those technologies that I don't think will ever go away, because it was just so good. It's like here to stay, and it's not something that's like, it's like those wavelengths are just gonna
whoever made it back then Genius.
They're definitely own an
Thumbs
island
up
somewhere.
for me
Thumbs
for
up for
Fraxel.
me
I'm
for
getting one in
Fraxel.
January.
Yeah.
We'll post my
Same.
face.
We'll both do it. We'll do it on a podcast.
All right. The other one we want to talk about is
Let's talk about our laser hair removal.
Yeah, so we have a laser. It's called Alma Harmony XL. I've used a ton of hair removal lasers in my life. I've liked them all. I'm not going to say I haven't liked any.
Yeah.
I've liked them all. But I do find, which patients like this, is that the Alma one that we have is the least painful.
Well, that's good because
Yes,
in
and
the past,
I could say it too for myself because
Same.
I've had laser hair removal on myself. It is the least painful. So people come. But the biggest thing with hair removal to understand is I don't know how many cycles of hair anybody has. And every time you treat hair, you treat the one cycle that is growing. So we could go through the whole cycle of hair, but you have so many cycles of hair, so many hair follicles. Some are growing, some are dead, and
Some are resting.
Some are resting.
hibernation.
Yeah, yeah. So the only ones that get treated at that appointment are the ones that are actively growing. So we treat those. Your hair grows out, so don't call me the next day saying my hair is growing. You just treated me. No, it's okay if you have to. But those hairs will grow out, shave them, whatever. But then when the next hair cycle comes in, that's when you come back for your next treatment.
So that's
I find
typically
a lot
like
of people
6
come
weeks,
back,
right?
We're in like 6 to 8 weeks, but sometimes more.
Yeah.
I've noticed it more with this laser, honestly. Like I'll have my armpits done, and then it could be 3 months before my hair is really growing again. So that's great.
Yeah, that is good.
But I feel like a lot of times patients will come in and their hair is not really growing, and I'm like, hold off. Save your session, save your money, because we're not treating anything. I'm just going to laser you for what? For like 2 follicles? It's stupid. You know, so you really just want to wait till your hair is growing in totally to really make it worth it.
Yeah, and the one thing I will say, I don't like to do hair removal that often. So if you're a patient of mine and you're like, China, I want my hair removed, I send them to Lindsay.
Yeah.
Yeah, because it's just not, what's cool about what we do, and we can pick what we like, and that's just not something that I've ever liked, probably because when I've had it done to myself, I hated it so much, like just the pain.
China hates lasers.
I hate laser pain. But like, I guess like being an Italian chick, we're hairy. I've had so many laser hair removal.
A ton of follicles.
Yeah, we have a ton of follicles. Not anymore, thankfully, but I just send everybody to Lindsay because she's the expert at hair removal. However, I do explain to people that hair growth, especially on the face, can be hormonal. So if you're a woman and you're sprouting chin hairs,
very hard on the face to get rid
please
of.
don't think that 6 sessions of laser hair is going to get it gone for good. And I do tell people that it's laser hair reduction, not permanent removal.
Where you will sometimes have permanent removal in certain areas, but I find like in other ones, you can be very patchy.
Yeah.
Some hairs are stubborn. They don't want to go anywhere.
I've also like.
But at least they're thinner and they grow slower.
Yeah, and anecdotally, like throughout the years, I can sometimes go years without anything, say like in my underarms, and then all of a sudden I'm like, where did this come from? And then it's time for a touch up. So it's like nothing that's ever totally permanent. So I just wanted everyone to know that.
After being pregnant, that your hair started to grow again? Hormone changes.
Sometimes, in some spots maybe, and then in other spots, like no, where it was growing, it stopped.
Interesting.
Yeah, I mean, pregnancy does weird stuff to your hair in general. Your hair is going to fall out. Sometimes it grows.
It's like you never know.
Who knows?
But sometimes patients I know, like they're doing hair removal, they want to get pregnant soon. I'm like, just hold off till after, because I've had other people where they do their hair removal and then it is getting crazier after being pregnant with the hormone change.
Yeah.
So it's like great.
Another hair removal tip is you want to kind of do your hair removal treatments before your hair loses pigment, because
once it's white, forget it.
Once it's gray, it's nay. Once it's gray, it's
you're
nay.
done. You're
you
done.
Cannot
you
get your laser
forever. Then you have to do electrolysis. Which is
or wax
terrible.
it. But you want to make sure you get your laser sessions out of the way before you lose pigment, because the laser's targeting
so if you're
the pigment.
Before you're 35, get your laser hair removal, because everything changes after 35.
It's very sad when the first gray sprouts. So I'll just let you know that.
Oh boy. All right,
so thumbs up for hair removal.
Thumbs up for hair removal. Changed my life. I barely have to shave my legs. It's amazing.
Cool
Okay.
beans.
Next,
IPL. Let's talk
IPL.
about photofacial real quick.
Photofacial. So another handpiece on our AMA laser is IPL. Everyone knows about IPL.
Everyone
it's for
knows IPL.
discoloration. You could use it for rosacea, again, brown spots. You could use it to help melasma, all those kinds of things. It's what it is. It's a light-based treatment, bright light. So expect that during your treatment. Pain level, not too
Snapping
bad.
rubber
It's
band.
snappy. It's snappy.
Level 3 or 4,
Yeah,
I would
I'd say
say.
it hurts more than hair removal.
Yeah.
Not as much as the other device. Like you don't have to numb for IPL. I guess
No.
you could if you wanted to, but not
In
usually.
fact, I mean, I usually don't numb people for
I don't.
IPL because
No.
I need to know if it's like really hurting, then I need to adjust my settings.
Correct. So I think it's probably better to not numb.
To not numb.
I've never numbed anybody for IPL. I've known some other practitioners that have, but it's kind of like you want to know if they're burning them.
Yeah,
It's
no
kind of
one's
a
like
good
really run
safety
away
thing.
from
Yeah.
it. It's one of those lasers where like you might feel the snapping
Yeah.
and you get a little jumpy.
But it's quick. It's
But
usually
it's
a
quick.
pass or two. It's no big deal.
Downtime for that is really minimum.
You could put makeup on right after.
The brown
There's no-
spots tend
yeah.
to like come to the surface and what we call peppering, where you get these like little the freckles might get darker and then kind of slough off.
I feel like for me, I make sure they're darker
Yeah.
before someone leaves.
Yeah.
They got to be darker, or else you didn't get a good treatment.
Right.
Yeah.
And IPL is also good for rosacea and red spots. So if you have
Yeah.
rosacea and like little capillaries that are forming around the cheek area,
or like even like little ones around your nose.
yeah,
nostrils, that have little
photofacial
telangiectasias.
may be a good option. Yeah, those little capillaries are annoying.
Can get swollen. I do tell my patients you can definitely get a little swollen from IPL, especially if we go around the eyes or on the under eyes. And if
Or-
it's like for a rosacea patient, I feel like they're sensitive and they get a
And
little
if you're on like medication that causes you to be sensitive to light, so like some antibiotics for acne can
Yeah.
sometimes make you sensitive to sun. So if you have a warning on your medication that says stay out of the sunlight,
Tell
you
us.
could burn, just let us know
We need to
because
know.
we might pre-medicate you with something to reduce swelling for your treatment.
Yeah, or change the
Another
pulse
tried
width,
and
you
true
do pretty
laser
good.
though, IPL's been around forever. Technology is constantly changing, but also a device that's been used in the derm world and in plastics
Forever. There's also some IPLs that are used for hair removal.
Yeah,
Stuff
true,
Like that.
true.
But yeah, IPL is good. I would say also thumbs up.
Thumbs up.
If you don't want the downtime of Fraxel, do the IPL.
Yeah, or a combination of the two. Sometimes I like to hit things at different angles, so you'll see me
Also,
recommend.
I feel like IPL. I feel like I like Pico Photofacial too. I feel like they're about the
Pico's
same
good.
for me.
Yeah, I
Yeah.
used to do them together, like where you would do 2 photofacials and then 2 pico facials, and that really combated the different depths of brown
Everything.
spots. My grandmother used to call them liver spots on your
Yeah,
face.
liver spots.
right?
Oh, yeah.
I feel like I'm getting them, but yes, we.
No, you have
I am.
no liver
I am. I
spots.
do.
No, you don't.
They're there. They're totally there.
Fraxel in
We're gonna
January.
Fraxel and photofacial.
January.
So yeah, thumbs up for that. Minimal downtime. Just can't do it in the summer.
Yes,
I would
can't
say
do it in
no.
the summer.
Nay
Really,
for the
nay
summer.
for the summer. Also for Fraxel too.
Yeah, Fraxel is a-
nay in the summer.
And also, if you have melasma, so we talked about melasma briefly. It's like something that can be that we could work with. We have a lot of options for melasma, but something we need to know in consult because sometimes I put you on medications for melasma for a little bit before we
Before you do
laser you.
treatment.
Yeah.
Yeah.
So yeah, all right, energy-based devices. Let us
That's
know
it.
if you have any questions about anything we talked about,
Yep.
or if there's more information that you need,
wanna know.
we can dive into.
Absolutely.
Hit us up, send us a message, follow us on Instagram, It Aesthetix, Botox
it.
Boss,
Here.
China Bee, Beauty NP.
We're here for
Check
you.
us out. We'll see you at the next episode.
Unfilter It.